Hi, I'm Paige.
I'm Marissa.
And I'm Kimberly.
And today we'll be talking to you about the celiac disease.
Today I'll be interviewing a scientist who specializes in celiac disease. So can you tell me about the celiac disease?
Celiac disease is a negative immune reaction to eating gluten, which is found in wheat, barley, and rye.
So what are some symptoms of this disease?
The symptoms of the celiac disease are diarrhea and bloating, but it's typically hard to tell if you have it because it's so similar to other diseases. Therefore, it takes doctors about 6 to 10 months to diagnose someone with the celiac disease.
Here's the DNA before and after protein synthesis for the most harmful amino acid sequences. Can you tell me about the amino acid mutations that cause celiac disease?
The most damaging proteins consist of proline and glutamine, but especially the amino acid sequences, which consist of proline, serine, 5-glutamine, and 1-proline.
The celiac mutation occurs in chromosome 6p21 in the genes HLA-DQA1 and HLA-DQB1. The left set of DNA is not mutated, while the right side is affected by the point mutation.
HLA, also known as human leukocyte antigen molecule, sits on the surface of all cells presenting antigens. When a mutation occurs in the gene, it causes the immune system to fight it off, which makes it weaker. It also causes the villi in the small intestine to inflame.
As you can see, on the right side, the villi's been affected by the celiac disease because it's been flattened and damaged from eating gluten products. Today I'll be interviewing Kimberly, who has a child dealing with celiac disease. This is her story.
The celiac disease mutation was not found in me or the child's father, but the celiac disease mutation was shown in a blood test done on our child when she was a baby. The doctors gave us the devastating call that the mutation was positive, and that has changed our life forever.
So how does this affect your family?
My child can't play as long as the other kids and can't go an entire day without a nap. At night, they must sleep between 10 to 12 hours to have at least a little energy. When they go to hang out with other kids, it's hard for them to fit in because they can't eat the same foods, and sometimes they'll have to bring their own or leave early. My child has to take supplements known as CQ10 in order to stay energized throughout the day.
The coenzyme Q10 can be taken to help boost the patient's energy. It is found in animals and in most bacteria.
My child is on a strict gluten-free diet that, if she does not respond well to, can lead to a deadly type of lymphoma. Gluten-intolerant patients, like my child, have a higher than normal death rate due to the lymphoma.
Thank you so much for sharing your story.
Fun facts! With this celiac disease, your body has a hard time processing proteins. Those proteins can be such as gliadine and glutamine that is found in most wheat.
95% of patients with gluten intolerance have HLA-DQ. 85 to 90% have HLA-DQ2, and 5 to 10% of patients have HLA-DQ8.
Carbohydrates are one of the most common organic molecules. Gluten is a carbohydrate, and since celiac disease patients cannot process gluten, they have to get their organic molecules from other places.
1 in 133 people in the United States have celiac disease. That is approximately 3 million people.
83% of people with CD are undiagnosed. Left undiagnosed and untreated, you are at risk for other serious health consequences, such as osteoporosis, anemia, thyroid disease, and even certain cancers.
Celiac disease can affect men and women of all races and ages.
There are 300 symptoms of the celiac disease and can affect every organ in your body. I'm Paige.
I'm Marissa.
And I'm Kimberly.
Thanks for watching!
My child